what are the symptoms of a stroke that you may recognize yourself or you may recognize someone having a stroke?
So I think that we have the video up. Maybe I can go over to the screen and show you a little bit. The way the brain functions, there's different sectors or areas that do a specific task. So for example, if you go to the back part of the brain, the occipital lobes, here you have vision. So if you have an injury to an area of the occipital lobe, you won't be able to see a side. So if you have a right-sided occipital problem, you won't be able to see the left side of space.
And so when you describe these symptoms to a doctor like yourself, you're able to then identify what part of the brain is impacted.
Exactly. So the neurologist is very good at capturing the symptoms of the problems that the person is having and saying, well, you can't see to that side, your arm is weak on this side, your reflexes are increased on this side, therefore the stroke is on this specific area of the brain, and that's something that we're trained to do. And the other is we use an acronym called FAST, and that's an easy way of teaching how to recognize a stroke. F goes for face, so the face can be droopy on one side, you might not be able to move it very well. A is for arm, so you can ask the person to raise the arm and you can see that there's weakness or an arm or a leg. S is for speech, so there's speech problems. You might not be able to articulate very well. Slurring words, or even what the person is saying does not make sense. They cannot understand what you're saying. It's like they're speaking a different language all of a sudden. And then T is for time, because again, that area of the brain is not getting oxygen. It's kind of under the water, and time is very critical. If we're able to fix that fast enough, then that person will regain the functions that they were losing and then have little disability.